Welcome back to New Day Cleveland. We are taking a step in the right direction, putting our health first. Dr. Frank Dockler is from Healthy One Weight Loss, and he's joining us this morning. Hello, and how are you? Good to see you.
Good to see you as well.
So we're talking about something today that I have to say slowly in order to get this accurate. Peripheral neuropathy.
That is correct. Good job.
What, now that I know how to say it, what is this? I've never heard of peripheral neuropathy before.
Yeah, so peripheral neuropathy, or sometimes just referred to as neuropathy, is a deadening of the nerve cells and also the blood vessels, generally in the extremities. They can be in the feet, which is most common. It can also be in the hands. A lot of people don't realize that peripheral neuropathy can also affect digestion, our stomach, our intestines, amongst other internal organs. So we've seen a lot of that over the years, especially because of our work with people with diabetes, thyroid conditions, with our doctor monitored weight loss program. Well, 60 to 70% of them are diabetic, and so that seems to be pretty common amongst the people with diabetes is neuropathy.
So would that be one of the main causes of this then, is diabetes, or who can get this?
Yeah, so it's estimated about 60 to 70% of all individuals with type 2 diabetes will have peripheral neuropathy at some point in their life, unfortunately. But many other things can cause it. Autoimmune issues, alcohol can cause it, any types of fluctuations in long-term blood sugar issues, chemotherapy, cancers, so some medications, as well as statin drugs.
Is it reversible at all? In certain ways, can it be reversible, or once you have it, you have it, and you have to figure out ways to treat it?
You know, many believe that it cannot be reversed, and typically it's addressed with medications. So things like gabapentin. Almost all of our patients that start here have been on gabapentin or are currently on it, or Lyrica. But believe it or not, it can be reversed. It's as simple as just regenerating. I know that sounds silly being as simple, but it really is. The regeneration of nerve tissue and blood, and also the use of nutritionals to help that process along. Extremely effective.
So what would you consider the short-term and maybe even the long-term side effects of having this?
Of having the neuropathy? Wow. Short-term side effects of the neuropathy, as I mentioned earlier, can be digestive issues, but primarily because of those deadening of the nerves in the feet, for the most part, people lose problems with balance. So our elderly and the people that have the neuropathy are more likely to fall or injure themselves. Problems with injuries to the foot, as simple as maybe a needle or something embedding itself in there, and because of the loss of the nerve function and sensory portion, people don't feel that, which becomes infected and leads to long-term issues. Problems with sleep, problems with golf, problems with playing with their children, their grandchildren,
wow,
are all parts of, unfortunately, those individuals have to deal with peripheral neuropathy.
Well, so this is where you kind of come in, right? This is where you kind of help us and save the day. When people come there to Healthy One Weight Loss, what can you do to help them through this process?
Right, so the first thing is we educate them. Tell them a little bit more about what they're actually experiencing. We have some videos, and following that, I sit down and meet with them personally. Also, Dr. Brian Miles, Dr. Matt Stasek, who are part of our Healthy One team here. Following that, an examination, and really to figure out if they qualify for this care and what we can do to help them. And if we can help them, there could be a lot of different parts to that. I'm sorry, go ahead, Natalie.
No. I just, as you're talking about helping them out, I think it's important for them to know that you're also offering a discounted fee for those who might be coming in and stopping by.
Yes, actually, for the next couple of months, I think we're going to go ahead and just keep it at $49. That way people can come in, they can learn a little bit more about the process without a lot of, spend if they're, it kind of lowers that bar and just helps us to get the information out to people. There's so many individuals that have already been told that this cannot be reversed, and in many cases that is just simply not true.
Well, it's good to know, because the last thing you want is for someone to turn their back on medical treatments or help because they feel like they can't afford it. So making it affordable for someone, making them be able to come in and get help from one of the three of you there is just, I think, a step in the right direction. I thank you. Everyone, the other two gentlemen seem so kind, too. So you have a great staff there on hand.
They're great.
Well, it's nice to see you again, and I thank you so much for educating us on this.
Oh, thank you so much, Andy. You have a great day.
Again, Healthy One Weight Loss, folks. You can give them a call.